guys, this is Jose Vasquez for another episode of Baseball Strong. Today I have my friend Keith. He's a co-host on the Eclipse Pain and Recovery Network. But before we get started with Keith, I want to get started with today's topic. Today's topic is effort is not the problem, capacity is. And so one of the things that as individuals we need to understand is that when it comes to health and wellness, it's not about the effort that we put in, it's about developing capacity. What does that mean? Sometimes we believe that harder is better, that more is better, when the reality is your ability to sustain a certain level of health. When we work at anything, it's not about getting it right one time, but it's about sustaining that ability over time. When it comes to money investment, for example, you don't invest money and expect to have a return next week. You let it sit, you put in little by little and you let it grow. Same thing with fitness. It's all about small efforts over time create results. And when you create these results, you develop the capacity to live the life that you want to live, whether it's sport, whether it's being a homemaker, whether it's a weekend warrior, whatever it is. When it comes to health and wellness, it's all about your ability to work and to be able to sustain that level of fitness. One of the things that I came across this morning in my reading is the phrase, revelation often follows repetition. So what does that mean? Over time, when you put in the effort, you put a number of repetitions. For example, you're working out for 4 to 6 weeks. The first couple of weeks, you may just be sore. You're not going to find anything. You're not going to feel anything. But over time, the more repetitions you put in, your body's going to start to tell you, hey, I feel stronger. Hey, I feel better. Hey, I feel more flexible. So when you put in the reps, your body's going to reveal to you the results that you're getting. And now you're going to know whether your effort is turning into results. Another thing to think about when it comes to health and wellness is the ability to kind of lost my train of thought here. Oh heck, I forgot my train of thought on that one. Well, anyways,
That's all right.
Let's move on to the next part. So one of the things I want to do every show is talk to the high school baseball players, give some tips, some ideas that you can use in your game. Right now, over the last couple of weeks, I've gotten a lot of calls from parents and players coming up lame. Their shoulders are hurting. They threw yesterday, and now they can't lift their arm. And so the first thing I want to say to you guys is, number one, this is normal. It's the beginning of the season. You're beginning to ramp up your workload. And so now you're going to be sore, and it's going to be normal. However, the key to being able to stay healthy is you got to learn how to read your body. Right now, you are just starting, and you got to learn to stay within yourself. I've seen a lot of practices also that when kids play catch or when they're practicing, it seems like every throw is a tryout. They're trying to make the team on every throw. Every throw is 100% effort. You cannot sustain 100% effort throughout a whole baseball season. So you have to slow down, set your feet, make throws correctly, and know when your arm is feeling good, then you can perhaps put more effort into it. But at this time of the season, my best advice is you got to learn how to read your body, and you got to learn to stay within yourself. Most big league players, the ones that play for 15, 20 years, the number one thing to their health is that they know when to turn on the gas. They know when to slow down. They know when to take the out. They know when to back off. They know how to read their bodies. And so this is very important for you guys to start learning right now. Otherwise, your careers are going to be very, very short. All right. So without further ado, I want to introduce my friend Keith. He's a co-host with the Eclipse Pain and Recovery Network.
Yep.
And we're going to do a Keith Tries It. Is that what it is?
What are you calling it?
What are we calling it? Keith Tries It?
Keith Tries It.
All right.
Dry needling.
Can I ask a question real quick though?
Sure, yeah.
I love how you talked about these kids in this beginning of the season, and they need to kind of stay within where their body is. Can I push that out to like all my friends that are watching that are chronic pain patients?
Yes.
Because we tend to try to do that on a daily, because it's like, where's my body at today?
Yeah.
I think a lot of time for a lot of chronic pain patients, it's like, where am I at today? Because today's not yesterday, right? And I think what you said, I love it. It's like some days we got to realize where we're at, right? It's not going to be 110% and everything today, and it's okay,
Yeah.
right? Maybe focus on, I guess one way to say it would be form instead of at 100% effort. Can do it right, and take care of yourself instead of just trying to through the whole thing. Because as a chronic pain patient, they call it spoons, right? We have a certain number of spoons we can use during the day, and we need to manage those. So I like how you said that. You're telling the kids, and it makes beautiful sense. It's like, kind of remember where you're at. It's the beginning of the season, maybe 75% on some of these throws when you're trying to warm up or in practice and stuff like that. You don't have to kill it with every single throw. Just like a chronic pain patient, we ain't got to kill it every single time, right? Yeah. Know where you're at and kind of respect it. And I'm not trying to change topics. I just wanted to kind of
but this is important
throw
because,
that out there to them.
Well, you reminded me what I forgot earlier.
Okay. All right.
Sorry
about that.
I was like, no, that's good. That's good because I was like,
good.
all day long, I wanted to say these two phrases, and I get here and I forgot that one. But consistency beats intensity.
Yep.
So, baseball player, chronic patient, the key to health and wellness is to be consistent with your approach. You're not going to have the same amount of intensity every day. You're not going to feel good every day. No one does.
Right.
And so when it comes to being healthy, you always have to, you wake up in the morning, you take inventory of your body, you know how you feel, you have a ultimate goal, you have a plan. And so, okay, so I don't feel good today. So perhaps my intensity is going to be at a 60% today. I'm going to get something done. And then tomorrow when I wake up, I'll say, okay, I'll go through the same exercise. Take inventory. Oh, today I feel better. All right, so now my intensity can go up. But it's not necessarily the intensity that gets results, is staying with it, is the consistency.
Right.
Because when it comes to, for example, weight training, strength training, you don't have to do it every day to remain strong. You could do it once or twice a week and still remain strong and maintain strength. Cardiovascular endurance, you don't have to do it every day. You can do it 3 or 4 times a week and still get results. So when it comes to fitness, all of these things are predicated more by your consistency than your intensity, because life is a marathon. It's a long journey. Now, if you were an athlete and you had a particular event, yeah, you lay it all out. But when it comes to life, you can't go hard every day. Otherwise, you're gonna crap out, so to speak. And so, the point that I was trying to make that goes with the other one is consistency is always better than your effort.
Right.
And so,
Sticking with something long term.
yes, you always have to stick with things long term to get results, because you're never going to get results on the first try, which goes back to the other thing. You continue to do it, and as you continue to do it, your body, you start learning things about yourself, mentally, physically, spiritually, that will let you know that your work is actually paying off.
Yeah.
And all things, diets, workouts, they all require you to at least do it for a period of time before you say, oh, this is not working. Just like any medicine, you take it for a few weeks to know if it's working. A diet, at least a month before you feel anything. Same thing, to strengthen a muscle, it takes at least in a range of 4 to 6 weeks before you see any kind of change.
Right.
So in order to get to those 4 weeks, you have to be consistent.
You have to be consistent.
And you're
to get
not
to there.
really, you're not going to get there if your effort is so intense every single time out that you're not gonna make it.
You're not going to make it. I wouldn't make it because I'd give up on the consistency.
Exactly.
I'd be like, I've been 110% for 4 days now, man. I ain't doing nothing.
Yeah.
You know what I'm saying? And I've taken time off or I've done 110% for 3 or 4 days, and I just don't have it in me to do it, right? And so,
But if you have that mindset of I'm going to be consistent, all right. So I went hard for 4 days. I'm going to take 3 days off.
yeah,
I'm going to back off for 3 days, and I'm going to get right back on my program.
yeah, that's true.
You know, so that's another thing that I try to explain to people, because sometimes life throws a curve, and we got to go hard for a week. All right, so I start thinking, all right, next week I'm gonna plan some rest.
Yeah.
I'm gonna plan some recovery. I'm gonna plan to do X, Y, Z to get my body right back to where I need it to be, so I can continue my journey to feel better, to be more fit, to lose weight, to get stronger, whatever it is. So it doesn't necessarily have to be day to day. It could be like 4 days on, 3 days off, that kind of thing. So
Yeah, I just think for I can't speak for all chronic pain patients, but I can speak for a lot, because a lot of them are kind of like me. The reminder is I got to just stick with it.
yeah,
I've got to just keep trying, do something for it that day, right? And if I'm in a flare, take a day or two off, but then try to do at least a little bit of something towards that goal, like on the third day if possible.
yeah,
You know, it doesn't have to be 50, 60, just do what I can do.
exactly.
You know, and that leads back to what you're saying. I think the consistency part, you know, and it's okay not to sometimes.
Yeah.
Right.
And along with that, your mindset has to be such that if I didn't complete my workout today, let's just say I didn't feel well. If you do half of it, you got to be okay with doing half, because you don't have it that day.
Yep.
And so if you go back the next day or the next workout and you complete the whole thing, now you're right back on the program. Yeah. And so one of the things that I found with the players a lot of times, that they were so disciplined to get their workout done, even though I know that we landed at 5 o'clock in the morning and we're tired, and I know I'm tired and I didn't play, and I know they're tired. So it took some convincing on my part to say, hey, listen, you got to be smart, and we got to cut back on the work, because you added stress by not sleeping. We added stress by flying cross country. We added stress. And so when we don't feel good, somehow, some way, we have added stress to our life. And so now that stress becomes part of the program, becomes part of the exercise, because exercise is another form of stress. So I have the stress of travel, and now I have the stress of exercise. So if this one went up, this one has to go down. And so that's how you have to try to mix and match what you're doing for your body, because it's all stress. And we got to consider all stress as part of the equation. You cannot just say, well, I do this type of workout, I have this kind of job, but then all these personal things happened. You can't ignore all that personal stuff. You can't ignore all the other things, because those are stressors that are going to affect your workouts, that are going to affect your overall well-being, because we all have one tank, one tank of gas. And so if we burn the gas on one thing, we'd have gas for the others.
I love that, because that really puts into a visual. It's like we're one body, but we have different stressors that are impacting us in different ways.
Yes.
Right. And we need to keep that in mind, that our mental stress can impact our physical ability, because we're burning the energy from the mental stress, and it could impact us in how we're doing things. One more question, then I'll stop asking questions. I'm sorry, but I love.
That's good. That's good talk. That's good talk.
I love picking people's brains and know this stuff, right? So if you are stressed, say, use your example. You guys get in at 5 o'clock in the morning, right? Or as a chronic pain patient, I had a terrible appointment the day before, and it's burning. I can't get it out of my brain.
Yeah. When
we go to do whatever our goal is, if we're going to go try to do like the PT exercises that you give us to take home, right? Does the possibility of injuries increase if I'm going to force myself to do those things, because I'm burned all this energy on stress or on other things, on life, right? But if I sit there and go, dang it, Jose told me I got to do this 27 times. All right, I'm going to do this 27 times.
That's a good question.
You know? Yeah. And so I guess the question I'm asking on behalf of all my friends that are pain patients or chronic illness patients is, we've got that extra stress, but I know I need to do these I'm supposed to do these exercises. Does that increase an opportunity for injury? Because I don't want people to say, they told me to do 27, damn it, I'm going to do 27.
Yeah. Yeah. The quick answer is yes.
Okay.
You can run the chance of injuring yourself. one of the things that I've been really into lately is the this thing called fascia. Fascia is a it's a layer underneath the skin on top of the muscles, and it is all over our bodies. And it is considered another type of nervous system. It senses stress, it senses tightness, it senses heat, all the things that we feel, it is absorbed by our fascia. Whenever we are under stress, stress causes all that tissue to tighten up, to restrict movement. And sometimes we ignore stress because we have to do the exercise. And the reality is that underneath we are our stress has caused us so much tightness and restrictive movement that we need to address that stress. We need to address our the fascia, so to speak. And so one of the things that is becoming, I know it's been around for a long time, yoga and a lot of different methods, but now even in the strength and conditioning uh, business, it is becoming more popular to address the fascia before you exercise. And so one of the things that I am starting to see a lot, and it's out there in social media, is breath work, making sure that we are breathing with our diaphragm, that we are not breathing out of our chest. And so if you had to do, for example, if you had to do your PT work and you've had a very stressful day, someone that is somewhat versed in this type of work might suggest, hey, before we exercise, let's do some resetting exercises. Do some breath work. Let's do some resetting techniques that I will do to you to relax your body, relax your brain, your ability to think, your fear. All these things play in your mind, and it's all absorbed in our fascia. And so if you had to do those 27 exercises and you had the right person, they might say, instead of doing the 27 exercises, perhaps today we're going to do some breath work. We're going to do some neuro conditioning, and I'll talk about that in some of the later podcasts because I'm going to bring in a guest that is an expert in that. And so perhaps switch those 27 exercises for some of the stress relieving exercises, because when we're absorbing stress, we don't move well, and those 27 exercises are probably not going to be done correctly, and we might run the chance to getting hurt. And I know that I'm not an expert in this area, but it's something that I'm really, really considering with all my patients, is making sure that they're breathing well, breathing out of their diaphragm, addressing their stress before getting into the workout.
Okay. I was just curious. And
No,
again, I'm not trying to hijack your show.
That is good,
when
because this is something that I want to touch on as I get further into this is that area of fascial training, because it is very important and is a very underutilized.
So it's almost like
approach.
Like relaxation, because I picture people when they're going to go work out.
Yeah.
Obviously, that's not me. Okay. But they get hyped up, right? You see these guys on Insta like swallowing their energy powder before they go inside, right? But it's, in some cases, like for me, it's going to be more breathing exercises. Calm down. All right.
Yeah.
You're going to survive this. This is not, you're going to be able to walk out of here on your own power, right?
Speaking of breathing exercises and calm down, they're going in on you in the chat. Lugnut's like, he's stalling.
Yeah.
You might want to do some of those breathing exercises.
Yeah, I think I need to right now, man.
Yeah, but like at least the idea is to bring the stress level down. And sometimes as a therapist, one of the things that I have to do is talk to the patients and talk them down from that stress. As they're telling me what they're going through, I try to find ways to calm them down, get them comfortable, demystify what we're going to do. And so that is part of the fascial training, because the fascia absorbs our emotions. It's almost, they describe it as a electrical highway that runs through our bodies on top of the nervous system. And so even a soothing conversation and reaching the patient and explaining to them that this is not going to hurt, or that it is okay to work through a little bit of pain, or it is okay to skip an exercise or two. That is part of the training. That because if I help you manage that stress and lower that stress level, then the workout will probably work and be able to.
Then the benefit, you'll get a better result in the long run out of it.
Yeah.
But I love it because what you're doing is like what Dr. Leek does here and what Katie does. You personalize it to that person. Yes. And that's such a foreign concept to a lot of pain patients, whether it's chronic illness or mental health or chronic pain. Too often, like we talked a few weeks ago on plans and how they don't always work for people. It's because it's all generic.
Yeah.
It's almost like you walk in and they go to Google before you show up and they print something off and hand it to you to go do. Yeah. But I love how you do that. You recognize that you've got to have that conversation with that person.
Yeah. One of the things that I always try to get across to people is that pain is a message. Pain is not a person. You know, so I know that everybody has pain. I mean, we all have different levels of pain, chronic, acute, or whatever, but pain is a message the brain is sending you. When it's chronic, it's because that message is stuck on replay. You know, it's just stuck in a loop. But I know that some people tend to create, or they personalize their pain, and their pain becomes them. And so,
oh man, we fight that because so many people will they'll let their diagnosis define who they are.
Yes.
And as Invisible, we help people fight through that. No, you're still Betty.
Yeah.
You're Betty, but you have this diagnosis. You're not, hi, I'm fibromyalgia. Also, my name's Betty. No. Yeah, Betty, I have fibromyalgia, but I also have 3 grandkids, 6 puppies, and a horse, right? It's just part. It's not who you are.
Yeah,
right?
and it's just that's where I think the role of the doctor, the therapist, is the coach, is to separate pain from the person. Pain is something that the brain is telling you that there's something going on. Sometimes it's worse than others, but pain is a message that God created to let us know that there's something wrong.
And, you know.
But that doesn't become you, or shouldn't become you. And so part of in my opinion, part of the rehab process is separating yourself from the pain and not letting it define you, define your life, define the kind of life that you want to have.
That's it.
And so that's the goal.
Yeah, but it's tough for a lot of people with diagnoses because it does impact every single aspect of what we're trying to do. But at the same time, if we can claw back, I'm me, but I have this though. I think that's a really big mind switch for a lot of people when we can make that choice. And I love that you personalize it, because it goes back to that individualized care. You're willing to take that extra 5 minutes with that person to calm them down, instead of just saying, hey, give me 10 minutes on the treadmill, and then come check on, let me know what's going on. No, you talk to them first to see if that nervous vibe is there, or that fear vibe is there, or is what the hell am I doing here vibe is, you know, to kind of calm and make sure everybody's, and if they're hyped, great, man, that's just a good thing, right? But at the same time, check where they're at before you do it.
Yeah, one of the things that I'm a big believer in, and I learned this with working with the players, because at that level, they all want to know why you're doing what you're doing. You know, there's a lot of money at stake, and they want to know why you telling me to do this or not. For regular people, sometimes their experience is they go to a doctor, they see them for 5 minutes, and they're at the door, take these pills and come back. And I found that the more you can explain to a patient or a client what you're going to do, what it's going to look like, what you're expecting to get in the short term or the long term. Sometimes I try to do it per session, because sometimes they come in with different levels of pain. And so like, hey, today, let's see if we can just get this. Because if I get them there, that's a win. And if they have a win, that session, whether it was cut short or not, at least they walked away with feeling like they got something accomplished, because we all want to get stuff accomplished. Yeah. And so if they understand why they're doing what they're doing that day, and we get there, then it helps them buy into the idea of, you know, if I stick with this, if I stay consistent, this is going to work, even though it might not look the same every day. But it's like, you know what, this guy does a good job of explaining what we're going to do, and he.
It's such a foreign concept to a lot of pain patients and to a lot of chronic people. It's because they don't get that explanation.
Yeah.
But what I think is a benefit for you, and I hope you realize when you take the time to do that, the trust people have in you just grows immensely. When you take that 5 minutes to say, we're going to do this exercise here, point of this exercise is, you came in with this pain, we're going to try to address this muscles over here. If we can get through this today, that's going to be great. And they get through it and they start seeing benefits from it. The trust in you is going to go through the roof.
Yeah, I mean,
it feeds itself,
yes,
right?
And I learned that the hard way, because when I was young and I first started in the business, I took a lot of pride in my education and what I knew and how many certifications I had and how many techniques I had. And then over time, I realized they don't care what I know. All they care is that I care. They want to know that I'm in it for them and not to show off my skills. And so it took me a long time, but I realized that not only was that useful for me and the players that I was working with, but same thing with my wife and my kids and my neighbor or whatever. If I can be of help, people are more focused on whether you care about them or not, or as opposed to, oh wow, he's a doctor, or wow, he's got these certifications. Oh, he was in the big leagues. Nobody really cares. Once you're one-on-one and people need help, all they want to know is that, does this guy care about me?
That's it.
And if you can create an environment where your explanation, your education, education like explaining, gets through to them, they're like, okay, yeah, I'll do it.
Yeah,
I'll do it.
And it's a win for everybody.
Yes.
And there's so much pushback in the, I don't mean to lump you in with all the bad medical folks out there, but there's so much pushback on that individualized care, on the whole idea, right? That they don't see the benefit of, you get the buy-in from the patient that you're working with. And that buy-in is so critical to them getting better. And if they get better, they're going to give you the credit for helping them get better. And that's one of those good circles that feeds on each other that you want, instead of the negative depression and the depression causing the pain and the lack of movement and stuff like that. So
and speaking of demystifying things, I hear you got a fear of needles. So in today's episode, Keith tries it. We're gonna try that. We're gonna try that because one of the things, one of the things what we're talking about here is giving people options, throwing out ideas, because the medical system is so wide that we can get lost in treatment methods and stuff like that. And I think it's important for the people that are listening that they know that there's more stuff out there that they can try. Pain management is not just about medicine and exercise. There are other treatment methods that have some merit. One of the things that's been around for a long time is acupuncture, dry needling. The way that we do dry needling here in America is different than acupuncture, because acupuncture, they follow the meridians of the body, and whereas dry needling, we follow the anatomy. And so one of the things that I want to tell the audience today is, and tell you,
remember that whole combination where you have to breathing exercise.
Yeah, we're gonna have to do some breathing and resetting with you. But it's important, like that. What in simple terms, what are the benefits? When you're in chronic pain, your pain signal is overactive. You're very sensitive. Sometimes people just a light touch to the skin can set them off. And so one of the things that dry needling helps with is it tones down that overactive signal. Another benefit is trigger points, tight muscles. When you are in chronic pain, we adopt postures that put us in really, really bad situations that create trigger points, tight muscles, the muscles of the back, neck, they become highly toned. And so there's some people, you touch their muscles and they feel like rocks, and they don't work out. So it's not from exercise, it's more from holding that posture. And so when we were talking about chronic pain and that pain signal in a loop, when that's what happens, that's the result. You're going to get highly toned muscles that don't move well, and when you do move them, they hurt. And the third part is it gives you some relief. And when it comes to making progress in this journey of chronic pain, um, you have to feel safe. If you get some relief from the dry needling and you move a little bit, oh, wait a minute, I feel a little safer doing this movement. And so it helps create a level of safety because the number one thing that I've learned from pain patients or from anyone that is in pain, they're afraid. They're afraid to move. And being afraid to move it's a bad situation to stay in for very long.
Yeah, because we overcompensate. If I move this way, it's going to hurt.
Yes.
So we reroute ourselves
Yes.
to do things in different ways to not move that way. I know that sounds crazy, but we do. You know, because hurting bad sucks, and we don't want it. We don't want that. So we kind of find ways to do other things.
Exactly. And the body's always trying to protect itself. And so my role as a therapist is to find the direction that you can move in without pain. Because sometimes I may have to stay away from that movement that hurts. But I know that the way that the body is arranged and the nervous system is arranged, I know that if your right side hurts, if I move the left side, there's a carryover. There's an electrical signal that crosses over to the other side of the spinal cord. And so that creates, even though I'm not getting a movement, but I am getting a signal to the injured area. And if I do this often enough, I get enough signals that it might break through that pain loop and then allows me to move. And so that's another one of the things that to consider is when you dry needling, I break through some of that pain signal
Kind
loop.
of interrupt it at least for a little bit, maybe.
Exactly.
And if we can get that to happen, that gives an opportunity maybe for bigger things.
Exactly. Right? That's the key to physical therapy in general. Sometimes we're trying to interrupt that pain signal so that we can move, and then see what happens. Then you can only move this far. Now you can move this far, and then now you might have a little bit of pain here. We stay here, and then once we break through that one, then we move to the next step. And so interrupting pain is the key to physical therapy. Really, that's another way to put it.
So feel better. So after you pull these needles out of my whatever you're sticking them,
Yes.
Is it like an instantaneous? Am I going to feel this when I go to crash
That's a
tonight?
good question.
When I'm watching TV tonight, or is it tomorrow morning? And then if it is instant, how am I going to feel tomorrow around noon? Right. You understand? I'm not going to hold you to it, right?
No.
Because everybody's different. Right?
No, everybody's different. I find that oftentimes when we use the electrical stimulation, you feel an instant relief, and then there will be a greater sense of relief the next day. So the electrical stimulation adds another part to this because the needles do their work. They break through the tissues. Sometimes they break through the trigger point. One of the things that happens under the skin, our collagen fibers are, especially when you have a chronic pain area, the collagen fibers are not arranged properly. They're in knots. You stick a needle in and you just spin it a little bit, and they wrap up like a spaghetti around the fork. And so it kind of loosens up those collagen fibers. So the needles themselves will do something. They also produce endorphins. They produce chemicals that will give you a localized pain relief. And then I add the electrical stimulation, which the electrical stimulation is faster than the speed of the signal to the brain. So when it comes to pain, one of the theories that is taught is a gate control. So the signals are getting to the brain and back and forth at a certain speed. If I introduce something that gets to before the pain signal, then I block that pain for a period of time. So the electrical stimulation is going to help with the interrupting that pain signal. Is going to try to get there. It's going to get there faster than the pain you're already feeling.
I told me electricity and needles, man. They just told me needles.
Oh, the electricity is going to make it feel better.
Okay.
It even makes the needle part feel better. So, all right. So de-stress, breathe. No, just kidding. So today, what we're going to try to do, we're going to do a shoulder protocol. One of the things that is very common, men over 40, women over 40, because of overuse, our rotator cuffs, our shoulders are they hurt a lot. Sometimes our rotator cuffs get real thin and then they lose strength. And because of posture and all that stuff, we create a lot of muscle tone around the upper trap and rotator cuff, back of the shoulder area. So that's what we're going to try to treat today. Okay? All right. What we got?
Let's do it.
You want to do
Okay.
it? All right.
All right.
Go.
So while for those of you in the chat, while he gets prepped, we're gonna hit you with some good music, some feel good. Let's bring in.
Yes, sir.
Keith, we can currently hear you. Jose, could you show us what area you're going to be working in here real quick?
And for the record, y'all, I did not see a needle. So everybody say thank you, Jose.
Yeah, they were going to make it. They were going to make it. So go ahead.
Oh, you're blocking. There we go.
Put this one a little bit. There you go.
That looks incredible. They're telling you don't forget to breathe, Keith.
I'm breathing, brother. At this rate, no, I'm not going to say it because I don't want to jinx myself.
Wow. Now, I saw you wiggle one. Was that what where you were talking about the fascia?
No, I was trying to yeah. Trying to feel the bone.
Oh, okay, gotcha.
Bone and I know where to stop.
Wow. So, Keith, can you feel if he touches or gets close to bone? What are you feeling right now? Walk us through, like, what do you feel when it initially hits the skin?
There's not much to it, brother. When it wiggles, I can feel that a little bit, but it's not like it's nothing like a pinched nerve type feeling or anything that's sharp or anything. It's just, ow, you know? I mean, it's not like...
Yeah, it looks like ow.
No, but it's not severe pain. It's not like a shock. It's not like a pinched nerve jolt or anything like that yet. It's just, well, I'm glad
a sensation.
Yeah, it's just like I'm glad that I'd stopped then instead of keeping going for the next 45 minutes, you know? It's nothing.
Just to look at it,
But that's
pushing
just
in,
kinda-
just looks so crazy.
But
Oh, wow.
that's why I want people to see it and to see somebody who's deathly afraid of getting needles stuck in them. That,
You know, if there's an opportunity, if your strength coach, physical therapy person, or your doc says, "Hey, do you want to try it?" I mean, I'm able to carry on a somewhat conversation while he's stabbing me, right?
Right, right, right.
And I know that's not the right term. It's just how it works in my brain, and I apologize for that. While he's putting the needles in, see, I can't even say the word needles. It I don't want people to be afraid.
Right.
No, is this something for everybody? Probably not. But if it's recommended because the doctor or the physical therapist that you trust thinks it might help, you know, anything that I can put in my bucket that might provide some relief, I feel like I need to at least try it. And I want people to feel the same way. It's not the end of the world. It's not something that's so far out that's not proven.
Right. Well, you know, Jose, I've got a couple questions coming in off the chat. So when you finish hooking him up, we'll do a little bit of Q&A.
Jose, how long have you been doing this?
Since I started here, right now, almost 6 months.
You've been dry needling for 6 months, or okay?
Yeah, I mean, as a therapist, it's something that I always got when I was, you know, I got treated many times when I was with the Rangers. Our therapist there did it a lot, so I was always very intrigued by it, and I always wanted to learn it. And so I found that as long as you understand what the structures are, it's a very safe technique, and anyone can learn it. Now, some people get really good at doing meridians and all the other things, but I always took a lot of pride in making sure that I always know my anatomy, because no matter what I do, I need to know how the body works, where the muscles are, what nerves do what. And so this is one of those things where you can learn very easily if you know your anatomy.
Yeah.
And of course, you got to take a training. So
Right.
I've done my training.
Oh, I wouldn't be in this chair right now if you hadn't done your training. No offense to you. I mean, you're a nice dude, but
Exactly. Well, I mean, that's part of the deal, you know.
you know,
Good intentions have to be followed up with expertise.
so
They said you're hooking up the jumper cables.
Yep. So now, this should feel like something like that. It shouldn't hurt.
right. It should feel more like a thump instead of a shock. Is that what you're trying to say?
Something.
Like a twitch.
Yeah, like a twitch.
Yeah.
You feel it?
Yeah.
Yeah, I see it twitching. I just want a nice, comfortable twitch. Yep, I see it jumping.
Can we do this to my abs later?
That's a good one.
And that's it. There's not much to it. So, yeah, look at that. It looks kind of nice. I did a good job.
Oh, wow. Yeah, you can see it jumping.
Yeah.
Hold on real quick. I'm going to cut back to that. Look at there. You can see doop, doop, doop.
If there's anybody I love watching, you need to know this does not hurt. I want to make that point. I can feel it jumping. It's kind of like, I don't know. This isn't any worse. I mean, I've had terrible experiences with TENS units, and I would choose this over a TENS unit any day of the week, just because, I don't know, it doesn't hurt. I can feel the twitching, but it's not a painful type thing at all.
You are my hero.
No, man, it's just,
Just the idea of needles just sounds scary.
yeah,
Right.
Because you always equate dry needling to getting shots.
Right.
Those needles are so thin, you don't even bleed when they go in.
It looks incredible.
Because if they bled when they went in, people wouldn't do it.
no, Oh, how? No.
Now there are some thicker needles for like the bigger muscles, like the glutes and things like that. But areas like that,
Thicker needles for the glutes?
yeah,
Wow.
Wait. This will work on my glutes too.
yeah,
I can twerk without the exercise.
exactly. Free twerking.
Okay, so for some quick Q&A for you there, Jose. Well, first off, how long does this have to stay on him?
So this treatment, most recommended treatment is 10 to 15 minutes. So it's not even that long to get results.
Wow.
Okay, and then some of the questions from the chat. How does one determine where to put the needles?
So so for the shoulder, what I did there, so the one at the very top, it's on the top rotator cuff called the supraspinatus. The one underneath that is on the other rotator cuff called the infraspinatus. And so the one across from it, so the one toward the middle of the spine, that's the origin of the muscle. And the other one is the insertion of the muscle. And so what I tried to do, and I separated them a little bit more just for the cameras, but you got we're dealing with 3 of the 4 rotator cuff muscles.
Gotcha.
And one of the lat muscles.
Got it. So basically, whatever group is hurting or whatever the muscle is hurting, you're kind of going on that group of muscles that control
Yes.
wherever that pain signal is.
Yes, because that group of muscles, when they're overactive, they tend to shoot the head of the humerus up against the shoulder blades and the clavicle. They call it acromion. And so it butts up against the clavicle and the shoulder blade, and that's what causes impingement. So if you get those muscles back there to relax, the head of the humerus kind of calms down, and it doesn't pinch up at the top.
Interesting. Here's another one. So, who was it? She asked a very good question. It was... Okay. Well, if I remember it correctly, is there a situation where you wouldn't use dry needling at all? Like, is there a type of patient that this just you wouldn't touch with it, or a type of ailment or pain?
Like if they had some skin conditions, you don't want to poke through that. You don't want
like sensitive skin.
No, not just sensitive skin, but like a wound.
Okay, right.
A fresh scar.
Right.
Now, when you're scarred up and it's healed up, yeah, sometimes you want to hit the scar because you want to break up that scar tissue.
Got it.
And certain positions, like you can still dry needle a pregnant woman, but you don't want to put her on her stomach.
Right.
So there's some areas that obviously you want to stay away from, but for the most part, there's very, very few contraindications for dry needling.
What about for like a compromised immune system?
That's okay.
Really?
Yeah, that's okay because that creates hormones that are probably not working very well.
Okay.
How about
Because this is about stimulation of the nervous system. Every time we enter a stimulus into the body, there's all kinds of reactions that are happening within our bodies. The brain is sending signals, the brain is creating hormones, detecting, lowering the pain threshold. There's all kind of bodily functions that are happening once you introduce a needle into the skin.
So we got an interesting question from Lugnut here. Mm-hmm. He says, I have to ask Jose, what happened with the dry needling done on TJ Watt a few weeks ago? Was it too aggressive or was it a different type?
Yeah, I mean, I don't know the exact story, but I know that as with everything, if you get too aggressive, you can mess things up. There are certain body parts that you got to use certain length of needle. There's also danger if you get close to the spine. You got to go at an angle because if you go straight down, you can puncture a lung. Yes.
Wow.
So
lungs the airbag.
Yeah. So when you asked earlier, how do you know where to put the needles? You gotta not only are you thinking about the muscles you're treating, but what structures are there. If you're close to the spine, you got to go at an angle so that if you miss, you hit bone, and you don't go through the joint and going through the into the lungs. So, and then there are certain nerves in certain areas, like the inguinal area, where you got to be careful because there are certain nerves that you might hit. And so, the most dangerous one is the lungs. All the others, if you poke a nerve, you're gonna feel a burning sensation. You just got to pull it out and maybe go off to the side and stuff.
I never considered a needle puncturing the lungs as being like a thing. No. I mean, it's a little airbag inside the body.
Yeah.
Hey, Jose, I got a question for you.
Yes, sir.
How big is the positive attitude towards it for it working? Like, if somebody comes in and says, I'm only here because my doc told me to do it, versus, hey, my doc said this really might help me out. I'm really excited to try it.
Right.
Do you see a difference in outcomes? You know, if people really believe it's going to help versus, I'm being forced to type of a situation?
Yeah, I really believe that attitude has a lot to do with it because, as we were talking earlier about the fascia, if you come in with this fear, this attitude, your body is going to be already kind of locked up, and no matter what you do to it, it might not unlock some of the benefits that you're going to have.
Okay.
I know that sometimes we can talk people into feeling good. Hey, how much better does that feel? And you're like, oh yeah, I guess it does feel good. So sometimes you can talk people into things too, but I think that I would say attitude has a lot to do with it.
Okay.
Here's one. And I was kind of looking this over to figure out exactly what was trying to be, I guess, asked here. But all right, I'm going to probably butcher this up a little bit. But how about having collagen, or what did you say, collagen?
Collagen.
Yeah, so collagen, gotcha. Collagen issues. So like systemic sclerosis.
Well,
as a reason to get
as a reason
dry
not to do it,
or
I
not
guess.
to do it?
Yeah. Well, you know, when I went through the training, the first thing we went through was all the precautions, all the things not to do. I mean, because that's probably the most important thing. The rest, you get more experience as you do it, and as long as you know your anatomy, you should be safe. Because this is such a small needle, such a small stimulus that I don't think it's going to have a larger effect. And so also, again, one of the things that we are taught is you introduce the needle, and if you're using needles only, no electricity, you just leave it there for about 30 seconds.
Wow.
You spin it around, you kind of poke around, see if you get a little twitch, and then you take it out, get another one, go to another spot. So there's different ways to do it. But when you do with electrical stimulation, you get a little more pain relief, added to it. But what I would say is that I don't recall that being one of the precautions.
Gotcha. I got another one here. So does insurance generally cover this type of procedure?
Unfortunately, insurance does not cover dry needling. I think there's only one insurance company that does. I can't remember if it was United Healthcare. But also, to demystify the cost, dry needling is something that you do maybe once a week.
Okay.
It's not something that you do every day or 3 times a week like therapy. So, dry needling could cost anywhere from $100 to $150 a session.
Okay.
And you might need 3 or 4 treatments to see if it works or not.
Right.
So you're really not out of pocket that much.
Right.
So it's not a treatment that you do long term. So, if you had an ACL surgery and you had to come to rehab for 6 months and you had to pay cash, $150 a visit, that's big. That's big. But as far as the dry needling, in 4 to 5 sessions, if it's for you or not, if it's working or not, and then it's short term, so it's not a really long term treatment.
So I got a 2-part one here. Okay, so on one hand, one, would you still recommend this for someone that's like frail, not a lot of muscle tissue, not a lot of,
Yes, yes, because the main focus of this is pain relief. You know, as long as you have a nervous system, dry needling should help.
wow. Okay, and then the second one, which I thought was pretty interesting, they were wondering if you could tell us what watts or amps you're putting through them currently. 210 or
yeah,
220,
no, so-
110.
hey, hang on. Hey, time out. Let's answer that question once it's turned off.
Yeah, yeah. Well, we don't use those terms.
Okay.
So, but no. This is so you go with frequency and the pulse. The frequency
Okay.
is in hertz. So for pain relief, you want low frequency. So that's probably about 10 hertz, and then the pulse is about 250 milliseconds.
Gotcha.
So like we use a certain parameter so that remember what we were talking about the speed of the signal.
Uh-huh.
We want fast speeds
Okay.
to be.
So it's really
sensitive.
just like quick jolts.
Yes,
Jip, jip,
exactly.
jip,
And so
jip,
that
jip,
yeah, and the frequency is 10 hertz, so it's like it's spaced out in 10 hertz, and then the pulse is just how fast it penetrates.
So would there be a big difference between, let's say, this and cupping, for instance?
Well, cupping is more localized inflammation. What it does, it peels the skin away from the fascia and the muscles, and so when you do cupping, and it adheres to the skin, the cup sucks the skin up toward the cup, and it tries to separate the layers, and so it's a little different. You still get your influencing the inflammatory response, which is what you want to do. You want to speed that up so that you get new chemicals coming into the area. So that's very similar, but it's more localized, and it's not as strong a signal to the brain. It's felt different.
That's what's up. And we got one that says, I guess Anaheim covers dry needling. So big ups to you, Judy. Thanks for letting us know that. If you guys need it, go sign you up for some Anaheim insurance. So how much longer do we have for...
That's a good question. No, I mean, it's not like it's
It's just got a minute. That's good.
yeah.
Okay, so we're at the 60-second
Yeah,
mark.
I mean, it's nothing. Okay. I'm going to let you remove the needles, and then I'm going to say what I'm going to say in case, in case I need to change my mind.
You'll give me a review until I'm done.
Yeah.
And could you... I kind of want to... Yeah.
How many did you stick in me?
7.
Really?
Do you feel any heat at all, Keith? Is there any heat localized in that area?
No, none.
Wow.
None. That one you just took out there, that was the only one that was a little irritating.
Yeah, that one was stuck.
But that was it. I mean, the twerking, or not twerking, the twitching, that didn't hurt. That doesn't. It's just happens, right?
Well, I see, like,
And
all the needles are out. So if you can focus here, see the little red blotches where
Yep.
the needles were?
Yep.
That's a histamine response.
Okay.
That means that those areas were a little irritated than the others. So there's nothing over here. And this one's red, this one's red, this one's red. So there was probably some junk in there.
Gotcha.
I'm sure.
Yep. So
Super
that's
cool.
That's it. You're done.
Whew. You're gonna turn the camera off my
Yep.
pasty white back for me?
You're clear.
All right.
Well, I'll wait to ask that question again when he gets to sit down again. So my question was,
All right, what do you think?
it, y'all, it ain't nothing. I mean, obviously I didn't look at the needles, but it ain't nothing.
Yeah, you don't need to look at
That
it.
ain't nothing to be afraid of. My first question was, is it normal for somebody to say that it feels less tense on this whole side over
Yes.
here? I mean, that's like somebody gave me like a 25, 30-minute massage almost.
Yes.
And that's the difference that I'm feeling here than over here on this
right
one.
side, yes.
So when can I come back?
Next week.
But
Next show, we do
just for that.
We do another body part next week.
Yeah, just for that little that release right there. We were talking earlier about how stress and everything, and how people's muscles get tense, because they're carrying stuff all the time. And as an invisible, someone with a chronic diagnosis, we're carrying that, right? And I know there's a ton up in my shoulders and in my neck.
Yeah.
And y'all, even just for that, that's worth the price of admission.
Plus, okay, so now you feel more relaxed.
Yeah.
Are you more likely to exercise now after that than before you got the treatment?
Yeah, because I can move.
Yeah.
I can move that arm.
Yeah, so one of the things that dry needling is not a standalone treatment. I try to propose to follow it up with exercise. So if you were one of my patients, we do that and go do shoulder exercises. Now that it's loose, now that the muscles are relaxed, that's the prime time to go ahead and hit that rotator cuff and get it working.
Yeah, it's hard to describe, but it does feel that much more relaxed on this shoulder versus this one over here. I know that there's no way I can really quantify that, but it feels more movement.
Yeah.
More elastic, I guess. I don't know, but it just feels a lot more movement there now.
And it also, when it comes to chronic pain, most people have chronic headaches, chronic neck pain. So there's a lot of areas in the back of the head that you can stick a needle.
Octolar or something, nerve back that runs across, that there's a specific migraine that there's not medicine for. That it gets teed up back here, comes up across the eyeball and then stuff like that.
Yes, I'd
love to try that for that type of migraine.
Yeah, so one of the bigger protocols that we learned was for headaches. The majority of the upper body training was geared toward neck and head and headaches, because that's what most people suffer from, chronic pain.
Yeah.
And if I can alleviate your headaches, you're probably going to do whatever exercise. It doesn't matter.
No.
So
yeah, it's I've got a friend of mine she's probably on almost 60 days of a migraine, and like debilitating in bed migraine type of stuff, and there's no treatment for it.
Yeah.
There's no medicine type treatment for it. I don't know if that would help her or not, but Amy, if you're here,
try it,
talk to Zach, make him give you $150 to go try it. Maybe. I don't know if it's worked for you or not, but because that would just be a relief.
Yeah. That's headaches is one of the more popular conditions for dry needling.
Yeah. That's see, I never would have, when I think of the clinic, I don't think about somebody coming here with migraines over to the physical therapy side. That's just, it doesn't. But again, when we have Katie on Wednesday nights as a chronic pain patient, nobody's ever even mentioned the possibility of seeing a dietitian and changing some of my eating habits to help maybe not fix that specific problem, but fix the body in general, right? And so that's why I love talking to you and watching you and listening to Amy. And I have to listen to Dr. Leak because, well, he's Dr. Leak. But to pick specialist brains like yours and Amy's, yours and Katie's, is just one of the big benefits of all this. And who's crazy enough to do dry needling on a live?
Yeah.
Keith tries it.
That's it.
Keith tries it. Well, he's one more down. How many more to go?
I don't know. I know.
We'll see. Yeah. We'll see.
Hey, I say you just keep going until you've relieved the pain.
I've got
this. We might try to exercise next time.
Okay. You got to needle me first so I can feel good to do it. I know I've got this. Today was this. Next week was with Katie. She's going to know exactly how many frozen burritos I eat a day, and it's going to be embarrassing. Doc said something about finding somebody to do a laser treatment on me. Somebody said something about cupping. I'm all for it, man.
Yeah, I do all that stuff.
Because again, the big problem, especially in the chronic pain family world, is the feds are cutting manufacturing of the meds. So like oxycodone will be cut 7% this year.
Oh yeah.
Like the capacity's cut 7%, mandated, right? So there's going to be shortages. There's going to be times that patients aren't going to be able to get their meds. So we got to have stuff like dry needling. We got to have stuff like Katie. We got to have stuff like Dr. Leak doing other things for us, right? Or your doctor suggesting other things. So when we can't get those meds, we're already practicing that,
Right.
Yeah.
right? So we're already working to get our levels down. So if we don't have the meds, we won't go skyrocketing by itself, right? And that's the whole proponent of what we do on Invisible, man. We try to people to try. I call it the Velcro approach. Just throw that stuff against the wall and see what sticks, and don't let the fear of needles prevent you from trying. If your doctor or your PT person or your strength coach says, hey, I think dry needling will help this situation, do what you can. I know a lot of us are on SSI and come up with $150. It takes forever. I get it. But if it's an opportunity, don't let the fear of needles drive you away from it. Don't let the fear of, oh my gosh, don't let that get to you. You saw that up there. I had, out of 7 needles, 1 was kind of uncomfortable, but it wasn't to the point I was begging it to yank it out. Right. And that whole twitching thing there's no pain there. There's absolutely no pain there.
Yeah. And the thing is that, let's say you try it once. It's either going to help you or do nothing. And so, maybe you spend the money and you're out some money, but at least you tried.
You can check it off the list and go, yeah, I've done this,
Yes.
It didn't work, but you know what? I did it.
And like many of us, life is about exploring what's going to help us feel better, do better, make more money, whatever. It's all trial and error anyways. So if you're in pain and you want to get better, the purpose of shows like this, the purpose of what we're doing here is to educate the public on all the options out there: diet, mindfulness, breath work, dry needling, exercise, you name it. So to be healthy, there's quite a lot of stuff out there to be healthy. I get it. But hopefully what we're doing here is demystifying things, simplifying things. I'm a big proponent of using simple words. I try not to be too fancy with my words because I want to be understood. I'm not really the type of person. I don't like to impress people with my vocabulary. I'd rather impress you with the fact that you understood me. And so when it comes to chronic pain, there's a lot of information. And I think the people that are going to get better are the ones that continue to seek out help, continue to try new things, and hopefully they find the right person that is able to teach and educate and demystify, help people feel comfortable, and get them to move better, because it's a process, and it's not one thing. It's always multiple things, but hopefully we're giving you guys options, ideas, different types of people, different walks of life, athletes, chronic pain, young, old, you name it. Pain is pain. Everybody has pain. But if you want to feel healthy, I think that we all need to invest in ourselves and put in the time. It might require a little reading, a little research, a little, interviewing different professionals, different doctors, different, different therapists and coaches and so on. But if you want to get better, there's better options than pain medicine.
Yeah. I think an important takeaway is you need to be involved in your own healthcare.
Yes.
And then a lot of us have gotten real stagnant because we run into like buzzsaw medical people that either don't believe us when we're telling when we're hurting, or they have their own agenda, or things like that, and we give up. And a pill is not a plan, and we have to be involved in our own healthcare. And if you've been around Invisible for a while, I don't think that's a new concept that you've heard from me. We need to be active in asking questions. Hey, can I try this? Or I read this. Can we give this a shot? Do you think this would help? because again, we need to fill that bucket full of as many things as possible in case those meds aren't available, or in case something goes wrong, and we need to have other tricks up
Your
our
body's
sleeves.
already conditioned for it.
Yeah.
Yeah, exactly.
Yeah, and we're not trying to say that that medication is not useful. Medicine is part of the process. I mean, there are certain conditions you need to have it, but in order to be healthy, the pill alone is not going to help. Because there's no pill for exercise, there's no pill for movement, and in order to be healthy, we need to be able to move, to live and to have productive lives. And so if we're stuck on a couch because we have a lot of pain, you can take all the pills you want. Your life's not going to get any better if you can't get off the couch. And so what can you do to get off the couch?
I think it's important for some of us that have been stuck on the couch because we have been not medicated correctly, or we haven't had found the right team yet, that it's okay to count, excuse me, it's okay to count getting up off the couch and walking to the other side of the room sometimes. That's okay.
Yeah.
It's not movement as some professionals might say, well, you need to go walk 5. No, it's not that. But compared to where my starting point is, me getting up and going across the room, that can be a victory in itself for a day.
Yeah.
For a lot of us, this is going to sound terrible. For a lot of us, getting a shower takes everything out of us, just everything. So like a lot of people, I shower every morning and every night. That's like a dream for a lot of chronic pain patients, whether it's illness or mental health or chronic pain.
Yeah.
And so the ability to do that more often, that's a victory, right? Obviously talk to somebody like Jose, or talk to your doctor before you do anything like really crazy, but maybe just set the goal, instead of 2 showers this week, maybe we can try for 3. And I think any kind of movement we can do is going to be beneficial. Then we can start building on top of that, right?
Yeah.
I want to throw 2 last questions that I found up here that I see are pretty interesting. One, she says, so dry needling affects the endocannabinoid system. Is that correct?
Endorphins.
Gotcha. All right. And then second one, how big of an area can you really dry needle at a time? Like the entire hamstring or really?
Oh, yeah. Yeah. I mean, some protocols call for 10 to 12 needles.
Wow.
Yeah.
And that could be over a pretty long length of your body.
But as a way to introduce needles to anyone, you always want to start with less, because in my opinion has always been, if I do a little bit and if it works, then I can do a little bit more. But if I do a whole lot, I'm not sure if the treatment worked, or she was scared of the needles, or there was too much stimulus.
Right.
So like less is better.
I gotcha.
So yeah, I mean, and we can just go, body part by body part. I mean, we treat the shoulder, 10 minutes. Then we go to the hamstring, 10 minutes. Then we go, we can spend countless hours doing it, but I think that the more you do, it's too much of a stimulus, and you don't know if it really worked or not.
That makes sense. Well, guys, I really appreciate all the questions in the chat. You guys really had them coming. Is there maybe one good short takeaway, and then you want to go ahead and wrap us up for the evening?
Yeah. Well, I think I'm gonna end it like I started. Consistency always beats intensity. Stay consistent. Whatever you do, keep it going. If you fall off the wagon, get back on the wagon as soon as you can. But the best advice that I can give anyone is to be as consistent as you can. And usually the repetitions will reveal the result. So this is Jose Vasquez and Keith for Baseball Strong. Thanks for watching, and we'll see you next time.